Hello, sir.
Good evening, Dr. Vinod.
Thank you for joining us.
Welcome.
Today we will talk about the field of surgery, sir.
Sure, definitely.
You are a practicing surgeon and you are into laparoscopy and bariatric surgery. So, to start with, can you please share your academic journey from college to till now, what you are doing now?
Okay. So, after my MBBS, as you all know that I had completed MBBS abroad. So, from my batch, the screening exam rule started. So, since I prepared for the screening exam, it was very easy for me to compete for the postgraduate entrance exam. So, the moment I passed the screening exam, immediately within 2 to 3 months, I cleared the postgraduate entrance exam as well. Then I plan to join the Diplomate in National Board of Examination. Currently it is called as DNB, and I've joined the DNB General Surgery at that time. The main reason for me joining is right from my childhood. So I wanted to become a surgeon all the time, but during the time of internship, when I went through all the postings, so only at that time I was very much interested into general surgery. So that is the reason why I have chosen the general surgery. So though at that moment I came to know that general surgery is a very long process, because we cannot end up doing general surgery alone, because more than that you have to do a thing called super specialty, which is again a 3 years program. So again, that is not a mandatory thing which should be done, but it's just an option. So in case if you feel that you need not go for a very long process of education, then you can choose the end field like ortho or ENT or ophthalmology, so that you can just complete with the post-graduation program alone.
Okay, sir. Okay. As you said, you aspire to become surgeon. So, in your opinion, like, what is the pros and cons of becoming a surgeon and becoming into medicine and into surgery?
That's a very difficult question. See,
yeah, see, there are preferences for each everyone,
right.
But still there is some general facts is there. In terms of financial also, like job opportunities also, like in your view personally, what do you feel like to becoming a surgeon and to becoming a physician?
Okay. Let me put it this way. See, truly speaking, there are no pros and cons of becoming a physician or a surgeon. So both are equally good. Main thing is it's the student's passion. What do they want to become after the MBBS thing? So as I already said, main time where they can choose these things is the internship. So I request all the youngsters to choose their field at the time of internship, because they go postings to different field of medicine and surgery. So that is the best time. In case if you are getting confused what should be done, better to ask each and every experienced person, so that you can have some idea. So passion is the main thing as far as I know. Truly speaking, surgery is a slightly more difficult field in terms of spending time, or in terms of mental stress for the doctors as well. The reason is the surgical aspect. See, I'm not comparing here, I'm just telling the fact what as a surgeon I face. See, it is, first of all, it is very difficult for you to convince a patient, that is especially for the surgery. So that is one aspect. Second thing is, the patient after the surgery, they should get well, and they should start trusting you. Supposing in case of any complication has occurred at the time of surgery or after the surgery, so that is the end. That patient will never turn up. I am not saying that the physician will not face such a situation, but in surgery comparatively it is slightly a more difficult aspect, convincing a patient, bringing a patient for surgery and making them well. And again in the follow up, if at all, if they have any such issues, they will always relate that particular issue. It's after the surgery it has happened, though it will not be. So that is a major disadvantage which all the surgeons face. And comparatively, the legal issues surgeons face a lot. So again, the main reason for that is we have to properly convince each and every patient before the surgery. You have to explain each and everything about the complications what they might face. If at all, if any complications are there, how I'm going to treat such things. So these are the very important things. And third aspect is the financial aspect. Compared to the patients who is going to be treated with the medicines or non-surgical way. The surgical way of treatment slightly involves more money. So that again we have to, being a surgeon, it is very difficult for us to convince, no, these are the diseases which can be treated only with the surgery, these are the things which cannot be treated with the surgery. So we have to really convince, especially especially in our country the setup is like that, where a lot of options are there. So we have to be very good at communicating and convince the patient for surgery. Of course, what I mean is, whenever the indications are there, of course we have to convince them in a proper way.
Okay, sir. That's very nice information. Then you take a step back regarding during your postgraduate period. So you have done internship. You have done your DNB in which institute, sir?
Yeah, actually, I have done DNB General Surgery in Voluntary Health Services. It is a non-governmental organization hospital which is located in Chennai.
Okay, sir. So regarding during your DNB. This is for the students who planning to join or already joined DNB. So what are the things they have to focus during DNB general surgery?
Yeah, so leave about DNB or MS. So now what I am going to talk about is any surgical field, not only general surgery, any surgical field, any student who is going to aspire or who has already started pursuing it. So main thing which I advise is, I want them to look after the medical cases as well if it is possible. The reason why is, only then you can be able to very well differentiate between how the patient is being managed conservatively and whether that patient is going to need the surgery or not. Because if we just focus on only the surgical cases, then you will not be able to differentiate to which pathway the patient is going to be. So that is the first thing. What I mean exactly is, supposing when you are in a surgical posting, you will be getting a lot of opinions. So it is not just enough you just go and give an opinion, nil surgical or nothing from the surgical side. So best is, it is always advisable to observe them, especially when you are being in a training program. It is always better, out of the way, you have to just go and keep watching that patient, how well they are recovering from. So that in that way it will be easy for you to focus later whether and easily differentiate whether such patients need surgery or not, because whatever is there in the textbook, it is just the learning aspect. But whether the patient is definitely needs surgery or not, it comes only by experience. So to shorten the span of learning such experience of choosing whether the patient needs surgery or not, that comes only when you see more patients.
Okay, sir. And I think you are into bariatric and laparoscopic surgery. So like that, what are all the like you can say subspecialties are there in general surgery? So the students can look after or they can learn. So and what are all the avenues and where in Tamil Nadu, what are the like opportunities here to learn them? Like in that aspect, can you give some comment?
Yeah. So as I have already mentioned, general surgery is the second step. So the third step is the super speciality, which everyone knows. It is a separate dedicated field like urology or cardiothoracic surgery or vascular surgery and so on. But having landed up in general surgery because of other reasons like financial issues or family issues, if you want or if you are getting stuck in general surgery, no issues. You can still survive and earn very well, and you can be satisfied with the job with the general surgery. The reason is, general surgery is like how I already told in the previous slides. It's only in India and in certain countries you have 3 steps, whereas in other countries it is only 2 steps. You can just stop with general surgery. After doing the general surgery and finishing off the exact exam, you have to take a special training program in the field of interest. For example, if you take general surgery now, you can go in the field of breast alone, or you can go do upper GI alone. Upper GI in the sense like esophagus, stomach. And you can choose bariatric surgery alone, or even if you are really interested, you can directly into liver transplant surgery alone. So there is no need of going to the third step and then switching into these programs. So I am not saying it is not necessary. It's again the student's choice. So likewise, you have other fields you can just specialize into or go training into laparoscopic surgery as well. So these are all the variety of options you have, and you have one more thing called colorectal surgery. So all these are different fields where you can directly jump from the general surgery into specialized. But my sincere advice, especially in Indian setup, if you are specializing in that particular field, it is slightly very difficult to survive, because our population, our setup of hospitals, our setup of medical system is like that. So probably in case if you are going abroad, you can choose a lot of subspecialty and go into, whereas if you are going to stay in India, my suggestion is be a general surgeon, get training sufficiently as per the legal aspects, either in laparoscopic surgery, or if you want to perform breast surgery, for each and every subspecialty you have certain legal norms that you have to undergo permission, experience in particular field. Supposing if you want to specialize only in breast surgery, there is a legal aspect and legal norms where you have to work in breast department for this many years. If you want to become a laparoscopic surgeon, again you have to undergo training in this many cases and all. So not necessarily you have to go through the third step, but you can just stop with general surgery and do some training programs, gain experience, and then you can start practicing. So why I am mentioning it is difficult in our country is again because of the reference which you get from the doctors, and you have too much of hospitals crowded, especially in the metropolitan cities. So I feel, and frankly speaking, I am comfortable being a general surgeon because I can operate in many fields. Like if I have already mentioned, I can do colorectal, I can do breast, I can do upper GI, provided I have sufficient experiences, and of course I do have sufficient experience in all these fields because I am working in a setup like that.
Okay, sir. And I think I just wanted to mention, like, one of my friend who actually has done his general surgery, and now he is totally focusing on diabetic foot. Like, I think it is important for the PGs to know what are the things are available currently. For example, like where we can learn in India, any avenue is there here?
Yeah, definitely. See, you have plenty of choices after the general surgery. So that is why just a few minutes ago I just explained to you. So it is the choice what do you make at the time of training. So supposing, and what your friend has made, that's a very good choice, because as far as I know, currently in Chennai or in many places there are very few surgeons who concentrate only on the diabetic foot, and that's a good choice which you have made. In fact, the place where I was trained, we also had a separate diabetic foot unit. So even I was very much interested at that time, but since I have deviated to a different set of departments, now I didn't think about that. But that's a good choice he has made.
Okay, sir. Finally, I would like to ask, like, what are all the different setup that you have been working on? Like, you've been worked, and what are all the differences, pros and cons in different setup, like nursing home or being a freelancer, or like working in a corporate setup? Like, can you, in your opinion, what are the pros and cons for, so that they can plan from the starting itself, like which way they can go? Like, if you have any knowledge about any government setup also, you can please give some comments.
Sure. So first I will just tell you what are the setups are there after general surgery. See, after general surgery, either you can continue in the government setup, maybe in the teaching institutions or in the non-teaching institutions. Second thing is, again, you can go into the private teaching institutions, or you can go to the corporate setups, or you can open your own clinic, or you can become a freelancing surgeon adhering to many small surgical hospitals. So these are the various options you have. Again, as I already said, there is nothing like pros and cons. It's all what you choose. So if you take me, I have chosen the toughest way because I always wanted to become a good surgeon and a busy surgeon. So to my knowledge, being in a corporate setup, you will definitely be busy. They will completely drain you out of work. Of course, you will get sufficient money for that as well. At the same time, you have to think about your family. If you take my family life, of course I am happy, but at times, most of the time, back at my family, they are not very happy because I hardly spend time with them. Especially I don't have any proper holidays. Totally overall in a month I have only 2 holidays or so, and we don't have properly called festival holidays or anything. Whatever holidays or leave I want, I have to apply. So it is the surgeon's choice, or the aspiring surgical student choice, what he has to do. If you want to learn, what I feel strongly is, after your PG training, better work in a NGO setup, non-governmental organization setup, or you continue in the teaching institution or the government setup for at least 3 to 5 years. The reason is, you will get a lot of volumes are there, you will get to operate on your own, you will gain more confidence. One unfortunate thing happening in our setup in India, especially in the corporate hospitals, is you will not be able to get hands-on the moment you complete your post-graduation. It's no fault of any mentor or any teacher or any corporate hospital, but the setup is like that. As you know, corporate hospital people pay a huge amount and then get operated. So, and our legal aspects are in such a way, the legal liabilities are more in a corporate hospital in case if any complication is being met by the patient after the surgery. So due to such reasons, it is difficult for you to expect any hands-on, especially in the surgical field, in the corporate hospital. But the other good aspect is you will be able to face a lot of all complicated cases. If you take the hospital where I work in, is a tertiary care center. So last 10 to 12 years I have been working in this hospital, and whatever cases I have seen is the most complicated cases which is being referred from the other smaller institutions. So that is one advantage I have. And the second advantage is latest technologies. Not only surgical field, even in the medical field or radiology or whatever it is. Fortunately, in the corporate setups, you will have latest advancements. So you will be working with the latest setup of instruments. You will be working with latest technologies. You will be working with the fresh minds, because in corporate setup competition is too high, and you have to be in par with the other hospitals where you are working. So you have to keep updating yourselves. At the same time, I am not discouraging the other way. Of course, government setup is also really good, but one advantage of the government setup is you will have lot of volumes to get trained yourself. So that is the aspect with the government colleges or the teaching institutions.
Thank you, sir. Thank you so much. And have you worked as a freelancer any time? Like, how was your life at that time?
Freelancer, truly speaking, I don't prefer. It's my personal view. It's not I'm blaming or anything like that. Please don't mistake me. My personal view is freelancing. It is more stressful job for the surgeons. The reason is you will be seeing a patient in one place, you will be operating. Suddenly you will get a call from the other place. So it is difficult for me to concentrate in one place or the one patient when I am getting a call from the other patient. And second thing is following up is a bit difficult for me, because I am living in such an area, maybe traffic is high or whatever. I am not very comfortable with freelancing, because I personally feel patient follow will not be very good, and other thing is patient, they themselves will not feel comfortable, because what usually the patient feel is whenever they want to see the doctor or the surgeon, they should be present immediately. So with the current scenario where especially in the metropolitan cities it is slightly difficult, so that is the reason why I didn't choose freelancing. Of course you can choose such things maybe when you are confident enough, maybe after 50s or the early 60s, maybe you can try such a thing. But as a budding and aspiring surgeon, I strongly suggest better work in a single setup, focus in that place alone, get trained yourself, and then it will be better if you go for a freelancing, because the patient's follow-up is very important, and patient happiness is very important after the surgery. So because in our setup, the patient who goes home happily, it's only they will refer a lot of patients back to you, and they will circulate your name among their friends or relatives or whatever. So that is why I feel working in a single setup, especially for the aspiring people with less experience, is better.
Thank you, sir. Thank you so much. And finally, one thing I would like to ask, like, do you have any experience with the aggregators, like the case aggregators? Recently they have been budding up, like so many aggregators are coming, like Pristine and Practo, like do you have any experience with them?
Truly speaking, I strongly discourage, and I am against such things. See, doctors should gain the patients from their own experience or from their own names, or the patients they themselves should refer. So those are the things which I feel will build up your career, rather than going for such things. So that is my personal view. So because again what I said is the patient's follow-up. Supposing if any problem is there with the patient on which I operate, they can directly contact me. Of course, I will give my number to that particular patient. If any problem is there, they will contact me. So the next day I come to know, okay, this patient is not feeling good, or probably some problem with the surgery or some complication the patient is having. So I would go back to them. In such setups, I feel I don't know how far such follow-ups will be good. No idea.
Thank you, sir. Thank you for sharing your views and opinions regarding general surgery. Hopefully, we'll meet in next topic. Thank you.
Welcome.